Hi students. So the topic for today's discussion is puberty. Let's see first how puberty is defined. So puberty is defined as the process of physical maturation wherein an adolescent reaches sexual maturity and becomes capable of reproduction. Puberty is marked with different physiological changes. We see that there's a growth in height of girls. We see there is appearance of breast, pubic and axillary hair, and it finally culminates as menarche. So for you, it is very important to remember these sequence of changes because the order in which these different physiological changes occur, that is a very favorite question with the examiner. So let's start. Let's start with the beginning of growth spurt. The first thing that you can actually see at the time of puberty is beginning of growth spurt. And this beginning of growth spurt is different from the maximal growth in height. So we'll be coming to maximal growth in height, which is something which happens later. So the first thing that we see is beginning of growth spurt. The next thing that we see is breast budding or development of breasts starts, which is also called as thelarchy. The next thing that we see is pubic and axillary hair, which is known as adrenarche. Finally, we see there is a peak growth in height or the growth spurt. And then culmination point is menarche. So we have 5 different stages in which a female's body undergoes physiological changes of puberty. What I want to emphasize to you is we see growth over here at 2 points. The point number 1 is beginning of growth spurt, and point number 4 is peak growth in height. These two things are very different. Also, the first visible sign is breast development in females. So sometimes, the questions they may be put forward as what is the first sign of puberty? That would be beginning of growth spurt, and sometimes it could be asked as what is the first visible sign of puberty? If that is the question, then your answer should be the first visible sign is breast development. Okay. Now, let's have a look at how different is female puberty versus male puberty. So, while we see over here that female puberty, it starts at 10.5 years and male puberty, it starts at 11.5 years. So, please notice that there is almost a 1 year difference between the starting point for female puberty versus starting point for male puberty, and that is the reason, if you just recall, when girls are in class 5, class 6, so you find that the average height of girls is more than the height of boys, and it's only later after a couple of years when this growth spurt it starts in the boys that suddenly you find that there's an increase in height, and then the average height in boys becomes much higher than that of girls. Okay. Now we've discussed that the first sign is growth spurt, but the first visible sign is thelarchy. And then yes, we have the other signs as we've already discussed. Pubarchy or appearance of pubic hair, axillary hair, then we have peak growth velocity, and culmination point is menarche. In the boys, the first sign remains testicular enlargement, and then you have other signs of puberty, penile enlargement, pubarchy in boys, and peak height velocity. All right. Now, a typical question from this topic would be, what is the normal sequence of pubertal changes in female? Now, please see that we have been given just 3 choices. In the previous slide, we had 5 choices, 5 steps, right? But here we've been given just 3 choices. So, amongst these choices, our best option remains, first it is thelarchy, then we have maximal growth velocity, and finally culmination point is menarche. Another question. They've asked the same sequence of pubertal changes, but now they have given us 4 options. So one is thelarchy, one is adrenarche, one is maximal growth velocity, and one is menarche. Now because we've given out of those 5 steps, we have been given 4 choices. So now our options would be thelarchy, adrenarche, maximal growth velocity, and menarche. Again the same question. This time they have given 3 choices, and the answer remains, it's first development of breast, then appearance of pubic and axillary hair, and finally the culmination point is menarche. Sometimes you can have simple questions like, what are the physical changes in puberty? What all they include? So yes, the physical changes during puberty do include development of breast. Yes. Growth of pubic and axillary hair. Yes. Menstruation also. So the answer is all. Also, I've seen this kind of question, what is the first menstruation in female called? So we all know that is menarche. Sometimes the students, they get confused with the age of puberty and the age of menarche. So please remember, we discussed the age of puberty is 10.5 years in females, right? But that's not the age of menarche. The age of menarche is 13 years. So the answer remains 13 years. And please remember that puberty, these physiological changes take place over a couple of years. It is not something very sudden. Therefore, when puberty is starting at 10.5 years, it's not like menarche will also be there. It will take some time. This is what is known as the HPO axis, hypothalamic pituitary ovarian axis. What exactly is this? So we know that there is this hypothalamus sitting on top of pituitary. It releases gonadotropin releasing hormones. They go and stimulate pituitary, and then pituitary, it releases follicle stimulating hormone. Follicle stimulating hormone will go and stimulate the ovary to produce estrogen. After a few days, we will have the LH also from the pituitary. This LH will go and it will cause ovulation, after which we will have progesterone. And then one fine day, we'll have neither estrogen nor progesterone, and this will be visible as menstruation. So this is the normal hypothalamic pituitary ovarian cycle which takes place during the entire reproductive lifespan of the female. What is important for you to know is that hypothalamus secretes gonadotropin releasing hormones not just at puberty but during the entire childhood. The only difference is that this GnRH secretion is continuous. So the GnRH secretion is continuous. And the different thing that happens at puberty is that this secretion becomes pulsatile. So we need GnRH secretion to be pulsatile to be able to stimulate the pituitary to secrete gonadotropins. This pulsatile secretion initially starts during night, then it goes on to also be there during the day, and finally, one fine day, this pattern becomes cyclic. When this pattern becomes cyclic, the HPO axis is established and we continue to have menstruation as happens during the entire reproductive lifespan. Alright, so what are the other glands which are involved during puberty? We have the adrenal gland, which leads to increased sex steroid synthesis, and we have three important androgens which are secreted by the adrenal gland: the androstenedione, dehydroepiandrosterone, and dehydroepiandrosterone sulfate. What do these androgens do? They go and they increase the sebum formation, the appearance of pubic hair, axillary hair, and there's a change in voice. So from an infantile voice, we come to a typical female voice. Sometimes you can have questions as to whether it is estrogen or progesterone or let's say an adrenal androgen which is responsible for pubic hair or axillary hair or increased sebum formation, and your answer should be an adrenal androgen. And if they've given the name, then these are the three adrenal androgens. Alright. Then we have the thyroid gland, which also plays an active role. And then we have leptin. Now what is leptin? Leptin is a peptide which is secreted in the adipose tissue, and this serves as the major link between body fat, HPO axis, and menstrual cyclicity. So this is the somatic stimulus for the onset of puberty. The more the fat, the more the leptin, the earlier the puberty, and this is the reason why we see these days the age of puberty is coming down. So this is a hormone, it's a peptide actually, peptide hormone which is permissive to puberty. So we see leptin has so many different actions. It is regulating the menstrual cycle. It is also controlling the appetite, the metabolism. Leptin has got multiple functions. And now we come to a new kid on the block, which is kisspeptin. What is this? So, we all know that hypothalamus is there in the brain, right? And this hypothalamus is going to secrete GnRH. Hypothalamus, it secretes GnRH, right? Who tells the hypothalamus to secrete GnRH? This hormone is kisspeptin. So what does kisspeptin do? This is a hypothalamic hormone and it stimulates the release of gonadotropin releasing hormone, and it is responsible for initiation of puberty. So if any question comes as to which is the master hormone which is responsible for initiation of puberty, please remember it is kisspeptin. And why this name? So there's this place called Hershey in US, and over there you have these chocolates, Hershey's Kisses. So this town or the city, Hershey, is very famous for these chocolates, Hershey's Kisses, and a new chemical, a new hormone was discovered by the scientists over there, and they named this peptin hormone as kisspeptin, from taking the name from the very famous chocolate Hershey's Kisses. Okay. GABA. GABA is another important key player in puberty, and basically it keeps hypothalamus dormant before puberty. So we have seen that different organs and different hormones are responsible for initiation of puberty. We have seen the physiological changes which occur in the sequence of physiological changes, and we have discussed the importance of remembering the sequence of changes. Next, we come to what are the physical changes at puberty in females. So let's start from the vulva going up inside. So vulva, yes, it becomes responsive to steroid hormones. You have increase in the size of mons pubis and labia minora and majora and deposition of fat. Then we come to the different changes in vagina. Please refer to this diagram, this one, the one on the left. So we see that vagina microscopic examination shows one basal layer, above that is a parabasal layer, then we have an intermediate layer, and finally we have a superficial layer, right? This is what a typical vagina looks like, a vagina during the reproductive years. Now just let's compare it with vagina from the prepubertal age. So this on the left side, this diagram you are seeing pubertal vagina or in the reproductive age, and on the right you are seeing prepubertal, right? What is the difference? So the difference is, yes, parabasal cell layer is present, true. In fact, this brown, this is the basal layer, that's also present. You have parabasal layer also present, you have intermediate cells also present. But the main difference is in this superficial layer. So, at puberty, estrogen present in the vagina, this causes the vaginal epithelium to become stratified, and the vaginal epithelium becomes stratified, squamous, non-keratinized. The cells, they become rich in glycogen due to estrogen. We see the appearance of Dodderlein's bacilli, which convert glycogen into lactic acid, which finally makes the vaginal pH acidic, ranging between 4 to 5. Right. What happens to the ovaries? Obviously, the ovaries are going to enlarge. Everything is going to get, enlarged in size. The ovaries are going to enlarge. They're going to become bulky. Why are they going to become bulky? Because these follicles, all these follicles, this layer, it increases. There is proliferation of follicles, proliferation of stroma cells, and the ovary, it becomes kind of elongated. Okay, next we come to uterus. So over here you can see a teardrop. What is a teardrop? If you divide it into half, the upper half is narrower and the lower half is broader, isn't it? This is how the uterus looks like prior to puberty. We have the body is to cervix ratio 1:2 at birth, and after puberty it looks like an inverted pear, or the body becomes heavier and the ratio becomes 2:1. So we say that a prepubertal uterus looks like a teardrop, and a pubertal uterus, it looks like an inverted pear. Then we have different breast changes, and it is important for you to remember these breast changes. So what are these breast changes? These have been divided into 5 stages, and these are known as popularly as Tanner stages. You have to remember these stages. So we start with prepubertal, which is elevation of papilla only. Number 2, breast budding. Number 3, further enlargement of the breast tissue. Number 4, the appearance of secondary areola and the papilla projecting above the breast tissue. And finally, you have mature breast. These breast changes are so important. You get so many questions on the Tanner staging of breast. So let's have a look at the questions which have been asked. Which hormone plays an important role in significant proliferation of fat around the breast? I have seen many students answering this as prolactin, but this is estrogen. So estrogen is the hormone which is responsible for fat around the breast. Therefore, we find in postmenopausal women there is atrophy of the breast. Why? Because there is no estrogen, so all this fat deposition around the breast, it decreases, and we have decrease in the size of breasts. Okay. Let's see another question which was asked. Until which age is the growth rate of boys and girls similar? So we discussed that puberty starts in girls at 10.5 years. It means prior to 10.5 years, the boys and girls, they were growing at the same pace. And after 10.5 years, when puberty sets in, so, changes they take place. Therefore, please remember that this question will be answered as 10.5 years. Okay. Now comes a slightly tricky question, which is based on Tanner staging. So there's an adolescent girl who's brought to the OPD with a history of delayed menses. On examination, the following changes are noted. So breast is elevated like a small mound. Unless you remember the Tanner stages, it is not possible to answer this question, isn't it? If you remember, in Tanner stage 1, it was a prepubertal breast, and Tanner stage 2, the breast appeared as a small mound. Therefore, the answer is Tanner stage 2. Okay. Another question, similarly. So, you're examining an 18-year-old woman and it appears she has mature adult breasts. What is the Tanner stage of breast development in her? So, please remember that we had 5 stages of Tanner staging of breast. We had 5 stages. So, the examination reveals that she has mature adult breast. It means that she is Tanner stage 5. I hope this question is clear to everyone. Then another question. Which of the following effects of puberty are not mediated by estrogen? So we see growth of hair, cervical mucus, vaginal cornification, and menstruation. Over here, it is very important to remember that it is the adrenal gland and adrenal androgens which are responsible for the pubic and the axillary hair. So the answer remains hair growth. Because cervical mucus, yes, it is dependent upon estrogen. Vaginal cornification, we already saw that when estrogen appears, there is the superficial cells of the vagina, they multiply, they become cornified, Dodeline's bacilli appear, and menstruation, yes, that is mediated by estrogen. So next we come to another Tanner staging, which is pubic hair. Again, important question. Lots of questions are asked on Tanner staging. So please go through these Tanner stagings again and again. Alright, so the Tanner staging says pubic hair stage 1 is, you can see there is no pubic hair. In stage 2, there is a small amount of long pubic hair, chiefly along the vaginal lips. Then in stage 3, the hair becomes darker, coarser and curlier and spreads sparsely. So it spreads sparsely over the skin around the vaginal lips. In stage 4, we have the hair which is now adult in type, but the area covered is smaller, and stage 5 is finally the hair is adult in type, distributed as an inverse triangle. Also, there may be hair on the inside of thighs. Okay, so let's see a question which is based on the standard staging of the pubic hair. There's an adolescent girl who's brought to the OPD with a history of delayed menses. On examination, you note the following developmental changes. What is the Tanner staging? So pubic hair is long and slightly curved. Going back to this staging. Obviously, it's not stage 1 because pubic hair is present. Stage 2, there is a small amount of long pubic hair, chiefly along the vaginal lips. So pubic hair is long, slightly curved. The answer would be Tanner stage 2. Okay. Now we have the different hormonal changes, we have the different physical changes, finally culminating as menarche or the first menstruation, which happens variably around 10 to 16 years, and the mean age of menarche remains 13 years. Please remember that after menarche, it may take 2 years or more for regular ovulation to occur, and so the periods may be really irregular initially. Alright. Now, let's see a question which has been asked on this. There's a 13-year-old girl who's brought to you with complaints of heavy menstrual bleeding, and she has attained menarche 4 months back. What pattern of bleeding would you expect in this patient? So, as we just discussed in the previous slide, we would expect irregular and often prolonged bleeding. Thank you. Be sure to do all the questions that we have discussed. Remember the Tanner staging. Thank you.